Hey everybody, my name is Dr. Chad Stemler and I'm a chiropractor at Well Chiropractic in Wexford. And thanks for checking out this video. What we're going to be talking about today is something called active release technique, or we call it ART for short. And today is just going to be kind of an introduction about what it is and things that we can help with and things that we can treat. And then later in the week, each day we're going to put out a new video that's going to get a little bit more specific on conditions and certain things that we treat, or people might have questions. Can you treat this? Can you treat this? So we're going to get a little bit more into some of the specifics later on in the week. Each day we're going to put out a different video. The first one is going to be tomorrow, which will be more on back and neck and spine issues. And then that'll be Wednesday is going to be upper extremity. Thursday will be lower extremity. I'd like to put out a video where I actually do some work on a live patient, so we're kind of working on that. So hopefully in the near future we'll be able to put out one of those so we can actually see what we're talking about. So unfortunately these videos are just going to kind of be me talking, so I hope they're not too boring and you get some information and hopefully questions out of them that we can help answer. So first, let's talk about what ART is. So it's been around since the 80s. It was developed by a chiropractor out in Colorado. So it's not something that is brand new. It's been around for a while. It's been tried and tested. And it can be very, very helpful and effective, really. So we talk about treating soft tissue injuries. So what does that mean? So soft tissue can be muscle, it can be ligament, it can mean tendon, it can be nerve. So as a chiropractor, we see, a lot of people that come in with back, neck, shoulder issues and other things. But in almost all of those, there's going to be a joint or a skeletal component with that, which that's what we take care of. We can adjust the spine, we can, get joints moving properly, try to get the spine aligned as best we can. But there's also typically some sort of soft tissue injury or adhesion or something going on with the muscle, usually the muscle that is binding things up as well. And so that's where ART comes into play. And what it does is we find, muscle adhesions or muscle knots or kind of, where tissues aren't moving the way we want them to put it plainly. And it's a methodology to get those tissues moving better. So we are able to kind of diagnose and treat the exact tissue that is not working properly or not responding quickly enough. And what this does, as we try to release that and get those tissues moving better, that's when we start to notice, or patients start to notice that they feel better, usually in a quicker time frame. It's not something that takes weeks and weeks and weeks. And usually we can tell within a visit or two whether or not the treatment is going to be effective. While ART is a great method for treating soft tissue problems, it is not the end-all be-all. I can't fix everybody. That's just one of those things. But do we help a lot of people? Absolutely. So some of the questions that I get from patients that are a little bit apprehensive is, does it hurt? And I always say it should hurt good. We don't want it to be uncomfortable, but we want it to feel like we're doing something. So if you've ever worked on a sore muscle, it kind of hurts. It's that good hurt, and that's what we're looking for. I don't want it to be painful. We don't want it to be super uncomfortable, but we want to know that we're doing something. Another question we get a lot is, does insurance cover it? And that can be a yes and a no. Kind of depends on your plan. So that's something that we can go over ahead of time if people have questions about that. That's something we can look into your insurance plan specifically, and if it's covered, it might be part of your copay or more part of your deductible, whatever. But that's something that we could have that conversation. Another question is, how do people find out about ART, or where do people find out about ART if they've never heard of it before? And that's another great question, because it's, like I said, it's been around a long time, but not that many people know about it unless you've been exposed to it at some point. So I will say most professional sports teams have a certified ART provider on staff, so they are getting these types of treatments. And so if it's good for them, it should be good for everybody else. But I find most people find me through referrals. I get a lot of patients that refer other patients, say, oh, I have a friend that has this type of problem or the same type of problem that I have. Can you help with that? And so most people find me through somebody else, through a friend or a family member or something like that. I've also had people come in off Facebook groups specifically for plantar fasciitis. There's, I'm sure there's Facebook groups for everything, but that's another way that people have done that. Also searching on the internet. Again, plantar fasciitis is one of those things that when you have it, you're looking for answers, especially if the regular treatments aren't helping, the stretches and things like that aren't helping. So through the internet, there is an active release website or active ART website called activerelease.com. And it has lots of great information on there about what it is, and might have some videos of Dr. Leahy who developed this thing. And it also have a list of certified providers. Now, to be a certified provider, you have to have been credentialed at least every 12 months, I believe it is. So I'm going to be transparent. I have not taken a seminar because of COVID last year, so my name is not on the website, but I have one scheduled. It's not coming up until later in the year, but I have been a certified ART provider since 2015, I believe. So just want to be upfront about that. If you go on the website and don't find my name, it will be back up there at some point. Let's see here. What other questions do I typically get? A lot of condition by condition questions, which we'll try to answer again in these next couple videos. I'm going to try to make these videos around 8, 9, 10 minutes long. I don't want to make them too long, but really we want to be able to be there to answer questions for people, because it is people can be apprehensive, and usually they find an ART provider as a last resort. They've done the PT, they've done maybe injections, maybe surgeries, or they're trying to avoid surgery. So we're usually, I oftentimes have patients come in and then they look exhausted. They've been through the ringer, they've done this, they've done that, they've done the other thing, and they just said, somebody told me to come here. What can you do? What is it that you're gonna do? How are you gonna help? And again, most times we are able to get, things moving better, muscles moving better, joints and bones moving better, and getting people to feel better overall. Even if they've been to a chiropractor before or previously, this is something that not everyone does. Again, if you go back on the website, you can search your area to see who is certified. And if you look at Pittsburgh as a whole, there's a lot of us here, but in the north, there's really not, compared to the total number of chiropractors, there's really not that many that are certified that do the soft tissue work. Treatment times, it's not you're in here for a minute and then you're gone. So you're with me one-on-one for usually 10 to 15 minutes. The first time maybe a little bit longer, 30 to 45 minutes, but usually each follow-up session is about 10 to 15 minutes, and it's not something where I'm showing you exercises and you're doing it. I'm actually doing this work on you. So it can be a little bit intense. I've had people sweat as we doing it, because it's, like I said, it's not too uncomfortable, but we want you to feel it like we're doing something. So if anybody has questions, feel free to message us. Look out for the videos that are coming out later in the week, and I look forward to seeing everybody back here, and we'll go over, like I said, stuff we treat with back injuries, stuff we treat with arm and upper extremity, and hip and lower extremity stuff later in the week. So I think that's all I wanted to cover for today, and I look forward to seeing everybody back here tomorrow. Thanks, bye.